finally, a source of raw, real, and honest information on healthcare issues that matter most. Welcome to BS Free MD. From the latest medical information to how to stay sane as a doctor or a patient, no subject is taboo and no BS is allowed. Now, let's welcome your hosts, Doctors May and Tim Hindmarsh.
Hey everybody, welcome to another episode of BS Free MD. We're excited you're here, and today we're talking on telehealth, touching on the pros, cons, and what we can do to make it better. But first, before we dive in, I want to give you a brief shout out from our sponsor this week, Contract Diagnostics. It is a firm 100% dedicated to physician contract reviews. They provide a service that all physician families will need at least one time in their careers, most likely a few additional times as well. I love this company as they've helped over 10,000 physicians understand not only what they are signing, but what risks they are taking for their family. All contracts are reviewed by an in-house attorney and presented in a simplified way back to you. Using custom documentation, compensation data, and times outside normal business hours, they make it easy for you. All packages are flat priced, so you know what you will pay up front. Residents and fellows can even make interest-free payments over time. So look them up at drpodcastnetwork.com/contract diagnostics or call 888-574-5526.
And remember, a contract is only as good as its actual quality, kind of like a condom.
There you go. All right. Let's dive into today's episode, all about telehealth as we know it, why we love or hate it, as well as our patients, tips, at least what I think are tips that we could do to make it better for both sides, and maybe the outlook for the future post-COVID or going forward with telehealth.
Awesome. Yeah, I've definitely had a love-hate relationship with telehealth. It was really interesting seeing how it evolved just, from the middle of March when we went on, the first real stringent lockdown, and we were actually doing a lot of telephone medicine and so forth, and then how it morphed into telehealth. We're going to have a little bit of a narrower view because we do urgent care, which I think is a little hamstrung in the telehealth world. Obviously pediatrics, doing well checks and so forth. There's a lot of things that you could do remotely that may be actually very efficient. For us, there's obviously only so much you can do. I mean, if you break your leg, you can't do it on a telehealth. So,
well, people have tried, at least from my experience. I was going to say, yes, there's at first, before we dive into the pros and cons from our point of view, because it is biased, because we are in an urgent care setting, that there is even, the difference between doing it in a group, urgent care family practice, versus an independent contractor who's a sole proprietor that's doing it and working for one of the big telehealth companies, versus someone who's even an independent practice person who's set up their own primary care, urgent care practice, or even whether it's specialty psychiatry, counseling, or big ones at home. And, just the differences in those. Obviously, from the physician side, we can only speak to ours, but I know that big companies like Amwell, Teladoc, Plush Health, those kinds of contract practices are flooded now. And in fact, I know that they stopped hiring after COVID because they just got flooded as physicians were laid off looking for work. And so from a physician point of view, that was a really cool alternative, but the market's totally flooded now. And I looked into it myself, and then I even looked at setting up my own independent urgent care local practice. But man, some of the cons for me were having to get your own EMR system, your own malpractice, your patient panel buildup, as well as like tail coverage, the costs of the EMR, the setup fees. I mean, then that deters a lot of people. So that's why a lot of physicians gravitate to being a contractor. But man, I was even just what I read recently, this one person posted on the telehealth physician forum that I follow that she said that she works for Amwell, and the company went public with their stock this year, and she now made more in 1 month as a shareholder in her stock than she made all year in pay from them last year. Can you believe that?
Totally. I would not go long on that stock. I think telehealth is going to crash and burn and eat a tremendous amount of crap, and then come back stronger than ever. But I think that although hey, it's one of the 2 or 3
it's
biggest.
Big.
It might be the biggest in the country.
I guess like 5,900 clinicians. So there's MDs, DOs, PAs, NPs, psychologists, and yeah, they're flooded. But I guess now that some people are only doing like 2 visits a day, it used to be they could be have 50 people in the wait box, and like the pay, honestly, you have to realize this one lady said that she switched over from family practice urgent care, and her income now is cut in a third. She's working 42 hours a week doing telemedicine, and is making a third of the money.
I'd sell used cars before I do that. It would drive me so completely insane.
And so, do you know what the rates are? You know what they're getting paid?
Yeah, they're usually I think what it used to be was $30 a visit.
Oh no, not anymore. So it varies, but it's pretty much around. Well, Teledoc's 23 to 28. If you do a video consult, you get 28. But usually it's 23, and most are around $25 or less a visit. So
sell that stock right now, because you can have.
I think I would rather be an Uber Eats driver like my daughter, who makes over $20 an hour, and see some of the countryside.
You can, what they say, right? You haven't made any money in the market until you sell it. I was up 63 grand in 1 day.
No, I'm not talking the market. I'm talking like working.
No, I know, but that's what I'm saying. If you were doing that and you were getting paid and you made way more in the stock than in what you got paid to actually do the service, then it's time to sell.
No kidding. I'm just like, for that amount of money. And I mean, and then someone put on there, which is pretty kind of funny. He called it pimpology. I mean, it's you're not going to be dealing with life and death stuff on there. If you are, you're going to be hanging up and telling them to call 911 and doing your due diligence and notifying authorities. But I mean, seriously, it's not the high end of the practice spectrum, but still, it's just not what we're worth.
Yeah, but I think again, I'll call BS on that to a certain degree, because what drove me absolutely crazy, or what still does in a large swath of primary care, ER is primary care for some people, unfortunately. Urgent care obviously is, and then of course if you are a pediatrician or a family doctor or internal medicine doctor that does primary care, the problem that I've always really driven me batty is, especially in acute care, there's probably 70 to 75% of what you see that needs absolutely zero medical care. Okay, like really, like if you sprain your ankle,
correct,
you don't need to see a doctor. Now you might need an X-ray to deal with that. Just let me get to my point here. Okay, right? If you have a cold, you never need to see a doctor unless you have some other complicating factor and you have a secondary pneumonia or whatever. Like, you never need medical care for that. So the vast majority of the visits that in North America are unnecessary. A lot of rechecks are unnecessary, I would say. Blood pressure checks, all that can all be done remotely. You can train people. You can train people in a group visit setting. There's way more efficient ways to do it than a one-on-one doctor visit. So I would see telehealth where you say, it's MIC medicine or it's pimp medicine or it's whatever. Yeah, sure, I guess. If you're just milling patients for money, and I'll tell you some of my horror stories in looking at companies and being approached and then being credentialed by a company and how unbelievably fraudulent it was. But at the same time, if you could get rid of even 20% of the visits that didn't really need to happen, and you could do those for a slightly lesser rate with higher convenience and higher volume, and use it as a funnel to funnel patients in that really do need to be seen, right? I mean, you should be seeing your diabetic patients with multiple comorbidities at least a couple times a year.
Oh, right.
But you don't need to see them 5 times a year. I
think we agree. I think I was just thinking more in terms of the acute care stuff, which and I guess this might be my own non-educated bias, thinking of these teledoc animal people calling in for them. Usually they're urgent care type stuff. I'm not thinking of these big
Right.
box places as a continuity type of care. So that's,
But you know,
what you're saying is true.
as much as I do not really enjoy it personally, and I wish that we were back to just seeing walk-in patients, which we can't do because of COVID. It's interesting because the system that we have in our medical group that we have started actually works really well. At least it works well on the respiratory side. We're trying to keep people away from being in an office where we see COVID patients. So we only see respiratory patients in the respiratory clinic. But a large portion of those people have had some kind of screening with the telehealth visit, which is great. If they don't have a fever, if they don't have an exposure risk, if they don't have comorbidities, we can order a test. They can get the test done away from the clinic.
Okay,
et cetera.
right.
It works.
Right.
That works absolutely perfect.
Right. So you're getting ahead of me here, because I was just kind of going down the road of sort of the different groups out there, different things,
Right.
so forth. But yes, so let's get to that. Obviously, I know that there's the big box companies that I mentioned that serve people for acute care type stuff, urgent care setting. Then you were talking about how important it is, I think, and we can do most visits in primary care for sure via telehealth, especially when you just need a face-to-face with your doctor and you don't need a physical exam. Things like counseling and psychiatry, I think it's huge and awesome, and that's that has its total place.
So I get a psych visit. Where do I get the psilocybin before the psych visit,
oh,
though?
brother. Well, I guess you need an in-office visit for that one, don't you? Just
Make me the tea.
Just like we're not going to be doing, your epidural steroid pain management via telehealth or your hip replacement, but follow-up visits for big post-surgical things that require just a peek or a talk, it all has its place. So from a broad point of view, there's pros and cons in different places, right? In medicine, we agree on that, where it can be used. True?
Yeah, no,
Yeah.
absolutely.
Okay. So let's get to, from our perspective, where we're at doing urgent care in a large group setting where we do have primary care docs and some specialty groups, our experience with it from physicians, we know sort of the pros and cons from a physician's point of view, and then we'll get to the patient's point of view.
Yeah.
So pros, what do you go? What do you like about it?
Well, I think that, I think I said most of it already, but I think the idea of keeping people out of the clinic that don't need to be seen for a whole bunch of reasons.
Right.
Like there's people that you don't want to see because they're sick enough that they're not so sick that they need a visit, they need a chest x-ray, they need some sort of intervention by a physician.
Right. And that would be obviously on the patient's part, something that, when I polled people on my social page if they'd used it and why they liked it. Absolutely. They don't want to leave their home if they're sick. They are too sick to leave their home. They're scared because of COVID. They don't want to be around sick people and catch things, germs,
right?
cooties,
and
all
you're
that.
Screening out a lot of patients that don't need to be seen in person. The thing that's blown my mind about it, though, is it's not very fast.
Well, wait. Don't get to the negatives yet.
No,
stay focused.
Like
pros.
You see the a positive is you could see more patients per hour, which might be true. Obviously,
doing telehealth. Well,
obviously, if you're doing procedures on somebody or somebody needs a chest X-ray and a nebulizer and a bunch of interventions, that's going to take a long time.
They put that a lot on. These, when I read these forums for these big companies where you can do 4, 6, or 7 per hour. Well, gosh, it just depends what it is.
If you're working for Roman and you're writing hard-on pills like 12 times an hour, yeah, you could do 12 of them an hour.
If you're lucky enough and it's just someone that says, yeah, I need a refill of my lisinopril, I've run out, please. No problem. Have a nice day. Goodbye. How often does that happen?
But I would argue that should virtually never happen.
Right.
Because they should have enough refills and enough lab tests that when you see somebody for a blood pressure check, you're actually doing something that's constructive. They're getting a regimented blood pressure in a controlled environment, et cetera, which, never happens in an ER and urgent care.
Yeah, but I don't think that you're going to be whipping through these visits, and is that
Well,
what you're trying to say?
You are, and I'll tell you how you can whip through the visits, and you can tell me if it's good or bad as far as the business model. But there's definitely a way to do it, and it's probably the most profitable companies right now.
Well, go ahead. I'm silent with suspense.
Okay, so I'll tell you the unbelievably dark side, which is essentially one step up from a drug dealer. So I won't mention the names of the companies. I should probably whistleblow on them, but there was one particularly when I was in between medical jobs. I had a locum coming up. I had a bunch of time off. I figured, hey, I'd try this telehealth out and see how it works, and see if I can just sit at home and watch football and bang through a few visits and make some money.
So those are a lot of pros.
And so they were, yeah. Well, that's the expectation. No, that's not pros. That's the expectation. So then this company's like, yeah, we'll sign you up right now. We need people in Oregon, et cetera, et cetera, et cetera. So then they sign you up, and there's zero training because it's just templates, right? And so the how they describe themselves are, we are a company that is writing for certain compounded medications and certain medical devices that patients want. Okay?
That leaves a big room for the imagination.
Okay, which is fun. No, but that's fair enough, right? Somebody who needs a wrist splint and they want it covered on their insurance and, whatever. So then, I did like 2 or 3 of these visits. I remember it was a Sunday. I remember it's clear as day. It's like a Sunday morning. You were at work, and I'm sitting there, and I'm like, I'll bang these out. And so I look at it, and, they send you a little profile because you can, first of all, the patient is called by like a caller to, screen them. That's like a medical assistant. At least that's what they tell you it is.
Mm-hmm.
And then you call up, and then you can listen to that. And then you call the patient. You say, hey, it's Dr. Hindmarsh. I hear that you are interested in this, back brace or this cream for whatever, rashes or whatever it was, right? And then I started realizing, I did maybe 2 of these. I called 2 patients. You call them up, and they're like, I don't have a clue what you're talking about. Like every patient. And I did like 2 or 3 of these, and then I'm like, I got to get away from this because I'm going to go to jail.
You're the new pick your hotel chain that you hate guy calling you up, scamming people.
Okay, so they literally, I said, do you want this? Whatever. It's it's covered by your insurance, et cetera, right? And then what the company did is they had these exceptionally narrow lanes. So they picked certain kinds of insurance. So for people on Medicare, they could somehow get approval by ticking all these boxes off with their pre-screener for like back braces and all this kind of stuff, which is nonsense because realistically, scientifically, for the vast majority of people, it's not do anything
right.
anyways. And it's super expensive, and it gets way overcharged to Medicare because Medicare's covering it, right? And so at any rate, I look at this, and then I figured out what they were doing, okay? And so what they were doing is the telehealth company was a front. Okay, so all they did was provide the technology to do telehealth and recruit the doctors and then get you crappy insurance and whatever else. And then what they did is they were approached by other vendors. So, like companies that are compounding pharmacies and DME vendors and so forth. And then they just had people cold calling people. Like, the telemarketing people and calling them, and it's like, yeah, do you have Medicaid, or are you in Medicare? Yeah. Do you have back pain? Yeah, because everyone in Medicare has back pain. Would you like a free brace? Would you like a free brace covered by your insurance? Okay, because I was going back, and then I was listening to us, and I'm like, I'm sleuthing this out, and I'm like, holy crap!
Could you hear them? Could you hear the calls beforehand?
You could hear the calls beforehand. Would you like a brace covered by your insurance? On and on and on and on.
So then you get to be the poor, sad sucker doctor that calls them next and said, hello, I'm the doctor. Would you like a prescription?
Right, because they can't just sell them.
Correct.
And they can't get them covered by Medicare without somebody's medical license in that state. And so I look at that and I'm like, holy crap.
Did they get a free 2-week vacation all-inclusive package as well?
No, but you sit there and you go, this is
that's terrible.
This is how this is not.
I don't
fraud.
call it telehealth though, but I guess it is.
Well, it is. But you see,
It's
that's
not really
the point.
Telehealth.
And I'll
it's
get
not
into
addressing their problem. It's selling.
Right. I'll get into this later.
It's
Of how it's the nature of emerging technologies that you're going to get weirdness that happens because it's an emerging technology. And so, but it was amazing. I sat there and I was like, how is this not Medicare fraud?
well,
Because the patient, like, it's one thing if you're Roman or Hims, right? Which are clearly online pharmacies. That's all they are. They're online pharmacies that uses the telehealth side to fulfill orders.
Right.
So they can give away the visit. They can pay the doctor 15 minutes for a 40-second, review of a text, right? Then they can write the prescription for Viagra and they can do a bunch of refills. So they get 6 months or a year or whatever's legal in that state of refills of a medication for $15, right? Brilliant from a business perspective. Completely legal. And the big difference is the patients they're seeing advertising and then they're approaching your business to get a need met.
well,
That makes sense.
Yes.
Right? They're not, it's not
No, this
like
is like
Roman is cold calling people up and it's like, are you 70 years old
this
and
is like-
can you not get it up?
like standing on the sidewalk with a sandwich board to get it advertised for a pap smear. I mean, really, this is soliciting medicine.
The cold calling for something nobody has any intention of getting. It's not like these people, and that's what just blew my mind. Well, but it gets better.
I don't call this telehealth though. I call it.
But it is. It's
sales
all
and marketing.
It's all in telehealth because they're using remote physicians with licenses in the states of the people they're calling, and they're writing a prescription in that state. That is telehealth, absolutely no question. The other one though, that it gets even better. Same company, okay, contracted with another vendor. In the middle of the probably happened by about May. So they found somebody that would write that was going to convince you of the merits of the hydroxychloroquine Zithromax combination. Okay?
Mm-hmm.
And then they were going to get patients that required treatment, and then you're going to take like medication and just write hydroxychloroquine,
Mm-hmm.
okay,
Mm-hmm.
and Zithromax over a telehealth through that same company. And I know exactly what they were doing. I didn't go on. I didn't check it. I didn't want anything near it, But I guarantee you they were cold calling patients and like, are you concerned that you get COVID? Do you want to have the treatment before you get it? I can guarantee you that was what's going to happen.
Wow.
Because, just in case you can have, and you sit there and you go, I mean, I get nervous enough doing an actual legitimate telehealth with a patient that's had 10 years worth of sinus infections. It still feels a little bit. And
the history right in front of you with the chart there.
And you have the entire chart.
And
And it still feels a little bit sketchy sometimes writing antibiotics in that situation. How about somebody you've never met that's on the other side of the state you live in that you're giving them treatment that is completely unfounded
it
in
sounds
any
like it's
medical
not even a
literature.
video consult. It's just a audio consult. However that may be.
Yeah, these are. Oh yeah, they were audio
That's
use.
so sketchy.
Right, but what do you think's going to happen when you open the door to a new technology? And that's the problem,
It's
right?
spooky, and there's always going to be somebody taking advantage of the thing, and there's nefarious people, and including the medical side of things that gets involved with this. Is just like horrific.
Yeah, I'm waiting for them to send me something next month where we're just mailing fentanyl patches all over the place.
Ooh, frightening. Well, I guess there's companies out there that would try to get doctors to do it. Good night. Well, all right. So I guess pros, I mean, we talked about the convenience at-home factor. A lot of physicians being able to do this on their own independently, contractor or through their group. If you are doing primary care, it sure is nice to be able to, patient that you can keep them safe. Patients like the okay, let's talk about the patient side of these pros. I mean, they like the access, right? It's convenient for them. You can pretty much be at work and you don't have to take the time off to go to the doctor. And so I've been on both sides of it as a physician doing these and as the patient. And I love it because if I can sneak in time and I could do a consult with my doc, then I don't have to go in and make the long drive. I know that, what I want to say, and they're, speaking appointments and that I don't need a physical exam. I mean, I don't need to have my rash. You can even do a physical on a video visit, which we'll get to. But, as far as keeping it simple, I love it. It's convenient. You don't have to sit in an office for 2 hours and all those things.
Yeah, the difference is when you have a televisit with your doctor, you treat it as an appointment.
Well, we're going to get to that as far as a tip as how people should.
You don't treat it as a watch me eat a sandwich.
We're getting to that part.
You've invaded my kitchen space with your telehealth.
I know.
So now you're going to have to watch me eat a sandwich.
Let's bop on over to the cons of these things. Some weird stuff that what we don't like and what we've seen as negatives with it. Let me just start from the beginning.
No one over 72 should be allowed to have a telehealth.
Start with before we even get the computer phone working is the connectivity issues. Have you noticed? Like where we work, it just gets me frosted and you as well. Because our IT department has been helpful, and they note that for us at least, it works better. And I know even in a different system with my physician that if I'm on my computer, it works better. If you're using an iPad, it's all right. An iPhone or an Android, like a cell phone, is not as good. And I know that there's different servers. I've heard that for us, Safari just doesn't seem to. I think Safari's the one that's the worst. I don't know, because they keep forgetting to tell the patients that IT knows. But anyway, most people like to use their phone, but it doesn't. It is the one that works the least effectively for where we work.
If you can't use a phone for this, you might as well shut your business down.
Well, I'm just saying.
No, I mean, really.
And so the ease of, the crappy connectivity, all that stuff. And we do have a lot of people, and they can be young and not very technically savvy, but that tends to not happen. It's more the elderly population that aren't really good with it. And so, man, I hate it when you're like, we're there and it's like going on our end and we're waiting. And because we do video visits, we don't do phone call visits anymore. But like they're yelling and the audio works, but they haven't turned their camera on, or the other where it's usually their audio's on and their video's on and there's no audio, and I'm trying to read lips and it becomes sign language, and it's just so frustrating.
I've got a lot of really good visits with the ceiling of people's houses.
So
or like it's staring like straight up their nostrils. It's like it's like they're
okay.
Like don't you understand that there's a picture on the screen of what I'm seeing? I did a FaceTime with my mom like a week ago, and I just got to see 92-year-old nostrils the entire time. It's like, look at the phone and see what I'm seeing.
Yeah, well,
no concept.
So that happens with.
It's just a voice coming from heaven.
I will say that I see that on the elderly side when they don't have the thing pointed correctly. They don't know, and then they try to flip the screen, and it's just a big kerfuffle.
Yeah,
but also with the young kids, they don't even give you eye contact now. They will have the thing so you can just see their eyebrows and up, and I'm really wondering what's going on down below that I don't get to see you.
No, or better, they just do whatever the hell they were going to be doing anyway.
Well, there's that.
So
and
if
that's
they're walking
everybody.
down the hall, I'm waiting for someone to like, let's have this visit. And then I, hear a door close and I just hear this. Well, I started to get a sore throat about 2 days ago because they're like grunting out a turd. I'm waiting for that. I know that day's coming.
I had somebody in the bathroom at work. I totally knew it. You could tell they were in a stall and the way it echoed in there. And I think I heard some water running. It's just people will be driving and they answer their cell phone and start talking to me. And I'm like, are you driving? Yes. I'm like, I'm hanging up. You call me back. I don't want to be party to like a manslaughter event in your vehicle. It's crazy. So
yeah, that side though, isn't it just Darwinian? And it's just like, as long as they're in the car by themselves and they don't kill anyone else,
So my whole point in this is just frustrating because there's like, it's different when you walk into an office. Well, it should be that there's this sense of, okay, now we're having a relationship in a medical setting, but when it's video, it's on a phone, somehow it just becomes like you're having a family Zoom FaceTime chat and people's kids are running around screaming. You get the eaters. You get all the eaters. They're always eating every time you do a call.
Yeah, I liked the Caesar salad stuck to the woman's chin. That was absolutely unbelievable. And she's still talking to me.
So gross. Yeah. So I do have a funny story that I want to share with everybody about the rooms and the patient, because so where we, in our setting, we're doing both telehealth / they're really video visits plus in-person visits. And we don't have our system's getting better, but a lot of the times, we would be so rapid with these. They had telehealth after telehealth, and I would just sit there and I'd get the pieces of paper and I just assume they're all telehealth. Every now and then somebody would pop in as an actual visit, but it was kind of rare because it was when everything was locked down with COVID. So I'm just doing one after the other, and it's going great. And there's another piece of paper, and I dial the number, and I'm like, this person it's weird. It looks like they're kind of in a closet, but not a closet, and this really funny colored wall that looks familiar. And I'm like, this is bizarre. And she was really, really quiet and kind, and I kind of heard some funny, weird, familiar sounds in the background. And then the visit's over. She says, thank you, and it's done. And I walked out of the room to get the next one, and I could hear her voice in the building. And then I just kind of stood there and I'm like, what? And then, of course, obviously, our MA comes back laughing her head off. And she said, did you know that lady was here in the room to see you in person and you just did a video visit with her? And she came out and went, that was really weird. I was waiting for the doctor. And she just like called me up on my phone. Fail, hashtag telehealth fail.
Yeah, that's good.
And so anyway, I felt like a total fool. But we had a good laugh over that. Anyway, the whole distraction thing's a problem for me. And then the other is people think, okay, so they'll call in with something, and sometimes some things I still believe as a female physician are not meant to be done via video telehealth. I mean, I'm a doctor, but it gets a little weird when there's a male patient with a problem that sometimes, or vice versa, but would require a chaperone present in a professional setting. And now you're doing this by video. And I'm like, this is like bordering on video porn. Like, I'm just uncomfortable
you're
with
not
this.
You're not starting the May Hindmarsh Peyronie's disease video conference extravaganza.
I had a patient last week who had a genital rash and as a kid, and I'm like, this is not cool. There's like not even a girlfriend around to be there as the chaperone. I don't know. It's just not good. I had a female, he's
used to texting pictures of his junk all the time.
Stop.
Get into the 2020s.
Well, he was only 16. It was really weird.
He's used to texting pictures of his junk all the time.
I've had ladies, sweet little ones, with the bad breast rash, who don't care about lifting their shirt in front of you. But even then, I'm like, this is still kind of weird. Then there are times when people have problems that you just shake your head and go, there is no way. Like, I have ear pain. Can you look in my ear? Or my throat hurts, and they're swallowing the camera practically, trying to show you their sore throat. And you know how it is when you hold your phone up or it's super close, the camera can't focus, A, and B, they're waving it around so it's out of focus. And they're like, can you see it? Can you see it? And I'm just like, I'm just
there's somebody I know that has them put the phone on their chest to listen to their chest.
No.
Oh, yeah.
Is this the clinician that has them do that? Okay, well, we're going to get to weird things that
So
clinicians recommend too, but
technology is coming.
it's coming.
That's gonna
as you can
change physical exam by leaps and bounds.
as you can tell from our point of view, it's fraught with a bunch of frustrations. And like I was going to mention from the little survey I did from my friends, someone said, it was really weird because they've been doing all their OB visits that way. And I'm like, well, that's kind of strange. I mean, other than just checking in to see how they're feeling, well, what the heck are you going to do via telehealth? Same with ear pain. Kids with ear infections, that's really tough. And anybody with like ear infection or thing where you really need a physical, severe pain and things like that, it's difficult. So
yeah, OB visit is kind of like the whole point is physical exam.
I know. And so yeah, she's like, this is really bizarre.
Please pee on the camera and we'll see if you have proteinuria or not.
You can do home dips for that. But anyway, the patients, from their point of view, I think the cons are kind of the same. I mean, when they need a physical exam and they don't really like it. And I know that I've heard that sometimes they just don't like the fact that they can't connect right, or I don't know.
Yeah, I mean, I think
it's more of on the probably.
But I think in defense, I don't think this is going anywhere. Okay, I think like we talked about, stock and all that in different businesses. I think that there's going to be a lot of people in the telemedicine world that businesses that are going to completely be crushed, because I think the big telemedicine kind of mill where you just go to a whatever doctor isn't going to work, because I think that the people that like this the most are insurance companies.
Oh yeah,
because
absolutely.
They can keep people out of ERs and have somebody seen immediately in the middle of the night, a kid that's freaking out, and they can do at least a triage and decide if they need to go in. And that's a huge, huge benefit. So I see this as exactly like if you look at what happened in the music industry. So in the music industry, everything was done on 4-track tape for, decades, right? So you big reel-to-reel tape, and then they take the tape, and then they do the masters and the mix, and they'd get it perfect, and then that would go off and it would be pressed into vinyl, right? So it was all analog. And so then you went from there, and when they first started using computers and tried to do digital recording, it was a complete disaster. Like it took them 10 times longer, and no one wanted to do it. Okay, well, because it was an emerging technology. You knew what it could do. You could see it. You could see, all of the stuff on the screen, much like you would see now if you're using Pro Tools in a studio. But none of it really worked because you didn't have the computing power to back it up. Now you can produce an entire album on your phone, right?
Oh, yeah.
So telehealth is the same thing. It's an emerging technology. You can't look in a kid's ear yet. You can't get a really good look at someone's throat yet.
Well,
you can't listen to their heart very well.
I know that there
yet.
are actually, there are tools that you can use that attach to phones and that physicians have. I haven't heard of patients having them for looking.
No,
at
but that's coming. That's
right.
going to come where you get a telehealth kit. Like
right.
You go to see your doctor, you get introduced to all of these different pieces of technology.
Yeah.
It would make sense for a lot of the insurers to just pay for it. $250 a kit. A standardized blood pressure cuff. You size it for the patient. You explain to them exactly. You watch them take their blood pressure. Like, honestly, you could make an argument in those situations, they'd be getting better blood pressures than they do in a lot of doctors' offices.
True that. I mean, we know that, with the new watches, you could get a really good heart rate. I think it's a 1-lead EKG strip, but you're right. Blood pressures. I mean, people can do their own weight, etc. Jumping ahead a little bit as far as like tips and things for exams to help in the American Journal of Medicine that we got January of this year that came out. I happened to see an article published called the Telehealth 10. I think they just coined that phrase and came up with it when I read the article. A guide for a patient-assisted virtual physical examination. And basically they're addressing, obviously, this new, probably here to stay, technology and things you can do to help the patient experience, and how you can come up with 10 things as far as examining the patient as well. And I found some of them were kind of funny, and some of them were really helpful. Obviously, it's good if people will do their weight, blood pressure, pulse, O2 temp. That's some stuff that absolutely people can be doing at home. Some of it's skin exam. You're supposed to do a full skin exam and have patient evaluate stuff. And the one that made me totally laugh, which just seems silly, is have the patient perform their own abdominal examination to see if it's soft, non-tender, and normal in size. If it's tender, distended, have them, press in certain areas to see. And I just like, what? You're going to have a patient assessed for organomegaly? Anyways.
Oh, yeah. My organ's giant.
But my favorite out of this
I've
list,
got the megaly.
Okay, is video clue. Like, this was like, have patients sit and ask them to turn their head to the left and observe the neck veins while sitting. Clinical pearl. Patients inhale to observe if their neck veins collapse, a sign of Kussmaul's sign, and look for giant A waves of tricuspid stenosis of the presence of a rapid or irregular pounding sensation. I mean, that's hard enough to assess in clinic, let alone in a telehealth. But I think they're grasping for things to fit their telehealth TED.
Yeah, no, I want to be the plaintiff's attorney prosecuting the guy that didn't tell somebody with shortness of breath and swollen legs to go to the hospital for an assessment for CHF because his iPhone told him that he didn't have Kussmaul's sign.
No, obviously they have some really, I'm not going to go through them all just for the sake of time and common sense, but they have some good tips on, you can obviously assess their breathing, and, their neurologic status and how sick they look and social things around the home, etc. But some of it gets a little, I think, ridiculous. But obviously from this article and publication, and you're right, it's here to stay. So any other big pearls or tips on your thoughts about where we're going with it? I mean,
my pearls are, if they don't need a significant physical, like you can look at somebody and see if they look really sad.
For telehealth for the future going forward.
Oh, no, going forward.
Any big predictions in your crystal ball?
100%. This is going to go the way every other technology goes. It becomes way better, way more efficient, and way more personal. So what does that mean? Okay, when Bill Gates approached IBM, when they bought the essentially DOS from that guy in Seattle for $20,000 or whatever it was. And they went to IBM to get it licensed. He understood that there was this burgeoning market. He saw something that nobody else saw. There's this huge burgeoning market where everyone's going to want a PC in their house. IBM they looked at it and they go, no. Computing's about mainframes and gigantic companies and selling huge amounts of gigantic pieces of equipment. The operating system is immaterial. It really doesn't matter. And they essentially just gave the license to him. And he said, I don't want to own it. I don't want hardware, nothing. I just want the license to be able to write this software for personal computing. He saw where personal computing was going. He also saw that the reusable piece, the piece that was going to have to be updated, the piece that you're going to need to, essentially the disposable part of computing wasn't going to be computers. It was going to be software. Software was going to be updated. It was going to be, sexed up with cool things, right? So he saw this complete opportunity, and that's exactly where this is going. So big, gigantic companies, okay, that are trying to, unless they become the format that allows you to do your telehealth visit at home, I don't think they survive. I think that who takes this market over is the gigantic EMR companies. It's a no-brainer. You completely enmesh.
Right, but I think what you're saying is that, obviously the in-office visit part of things is not going away, but that groups and physicians will be utilizing this more than before.
The technology is going to get better. You're going to be able to look at a kid's ear. You're going to, instead of being able to do half of what you could do or 2/3 of what you could do on a telehealth, you'll be able to do 80 or 90% of it. I think that's a no-brainer. Mm-hmm. It's going to be, I think, controlled largely by the interfaces we already use.
Correct.
So I think I would be nervous about companies like Amwell and whatever it is, the other big ones, because I don't think that's who wins. I think who wins is Epic. Companies like that,
right?
That are clearly they're getting into this world. There already are.
Yeah.
There's small EMRs that are already doing this.
But
But
obviously,
most importantly is the market. And the market is going to demand it. Like, millennials are what? Just tripping into 40-ish, 45 maybe at the very beginning. And there's no way in hell that population, when they're 65, 70 years old and they have a higher consumption of healthcare, are going to be willing to sit in a waiting room when they haven't waited for
Agreed.
anything.
Agreed.
Yep.
No.
Whereas, they used to get dressed up to go to the doctor. I mean,
yeah.
my mother's generation, you got dressed up to go to the doctor.
People used to dress up to fly in the plane. Now it's just a Slothville.
Now it's a Lululemon fest.
Now the plane is like the Greyhound bus. Remember those days? Oh my
Speaking
goodness.
of legislation, how about we make legislation where certain people can't wear yoga pants?
Moving on. I've got 7 quick tips on how to make your telehealth experience better from the physician and doctor's side of things. Number 1 is the connectivity. Make sure, if you can, you tell your patients, or if you're the patient, to use a computer if you can. It really does make it better. And it forces them to sit down at a table or in a spot and not be walking around like a dweeb in a store or in the bathroom at work. Tablets, great. Phones, last option. Number 2, make sure you have good connectivity wherever you are. If you are in a bad spot at work in a concrete brick box, as some people are, or if you're at home and don't have good Wi-Fi access, big problem. So that's the other part of that. Location, same with, if you're the clinician, usually we're in a spot where it's quiet, and make sure everybody's not yapping and giggling out the door, because that's not fair to the patients, but it happens. And same thing on the other end. If you are the patient, pick a quiet, space-appropriate setting. Treat it like an office visit. I mean, you wouldn't invite the whole waiting room riffraff in there and have a McDonald's feast party in the office. Well, I've seen that, but
no, I want all my Peyronie's disease visits done in a crowded bar.
Number 4, just set a time, just like you would for an office visit, and as the clinician, be mindful that the patients also treat this as their office visit. So try to stay on time and be respectful of that. The next thing is, it's helpful if you call when your MA or nurse is checking patients in, to have them take note of important things that would be helpful to the visit, like their vitals ahead of time. And patients just know that, yes, you can have your temperature done, your recent temperature, your blood pressure, your weight, if that's appropriate, like you have issues with edema, etc., write them down. So I think getting vitals ahead of time is something that we could remind patients to do, and would be really helpful.
Would be really helpful is to have the medical assistant watch them take their own vitals.
And I know that some independent practices require that. So I've heard. So
what? Because they want to get paid?
No, legally to document the vitals.
Yeah. No.
Mm-hmm. Yeah.
Otherwise you're not kidding.
So the next thing is, if you have kids or elderly people as the telehealth patient, make sure that they're there. A lot of times we have had visits involving infants that just aren't there, that just don't appear. It's the subject of conversation. Or if it's an elderly person with dementia, that someone's there to speak for them on their behalf.
Actually, some of the best visits I've had are with, adult children with elderly parents, where they're sitting together and they're like, "Hi, my name's Nora. I'm, Bill's daughter, and here's Bill," and he waves, and that's actually like the whole the advocate part.
I love
which
those.
We've lost a lot just generally in medicine because of COVID, is a huge issue. Patients need advocates.
Yes. And, I love it when they're in the room. I love it on the telehealth. And doing them with, with kids, it's, sometimes I get that they only want to sit when they're like 5 for a couple of minutes, but at least have them show up. You can see them, see what they look like. So I think that's...
If they're only sitting for 2 minutes, they're not very sick.
Exactly. Well, then it's just a good assessment. But we do need to see them. We need to see you. So remember that. And the final one is, please don't eat during your telehealth visit, because Tim is tired of it.
Exactly.
So hope that was helpful, just sharing the pros and cons from our point of view, from patient point of view. where we think it's going, and little tips that I think that we'll all find helpful. Before we go, just want to thank our lovely sponsor again and remind you that this podcast was brought to you by Contract Diagnostics. This is a company that specializes in contract reviews. Specialization is something we can all appreciate here. So again, when you or your family have contract needs, give them a call. They'll help you understand your contract and make sure it lines up with your interests and protect the assets that you covet most, your time and family. Find them at drpodcastnetwork.com/contract diagnostics or call 888-574-5526. I'll link that again on the show notes and the number, as well as the tips and the link to the journal article.
Outstanding. I think that wraps it up for this week. We will be back again with a brand new show next Thursday. We really appreciate you listening. We cannot do this on our own. We enjoy it. Give us feedback, positive, negative. Tell us if we're full of crap. We don't actually really care. We want to make it better.
It's no secret that medicine is a bit, uptight. That's why Tim and I created BS Free MD, to mix things up a little and have fun in the process. Besides, we are having these exact same discussions all the time, so we thought we might as well invite everyone to the party. If you really like us, you can get plenty more and maybe see one of Tim's cool tattoos on our Instagram or Facebook pages at BS Free MD. See you next time.
But we try to keep BS Free MD as raw and real as possible. We can't be held responsible for any medical decisions or discussions had as a result of what you've heard on the show. We know, bummer. But the truth is, we really do care about your questions. So feel free to reach out to us by email at doc@bsfreemd.com.